Some doctors on the front lines of the pandemic have more than COVID-19 to worry about.
What happens to my family, and what happens to me if I'm sick and cannot work? And if I lose my job, then I lose my visa.
Our immigration status is becoming a huge issue, which is giving us extra issues on top of everything that's going on with COVID-19.
Dr. Ridwan Baba and Dr. VINAY NIDADAVOLU both work as critical care doctors treating COVID-19 patients. At the peak of COVID in New York City, Dr. Baba says he was seeing 30 to 40 patients a day. And Dr. NIDADAVOLU has some patients that have to drive hours to see him in Louisville, Kentucky. But here's the thing, both doctors are on temporary work visas. A study by the Journal of the American Medical Association estimates that 29.1% of all U.S. physicians are not born in the United States, and 6.9% of physicians in the country are not U.S. citizens.
Is there a guarantee that my visa will be renewed every year? No, there is no guarantee.
While they're both trying to get their green cards, the odds are steep. Overall, there's more than 4 million people in green card backlogs, and only 140,000 green cards are available every year for skilled immigrants from any country. India alone has 200,000 skilled professionals on the wait list, and that's not even including their immediate families.
Just being an Indian origin foreign grad, my priority date is way too late. So the way things are, I will be around maybe 100 to 150 years before even my position comes.
But in the meantime, we're in the middle of a pandemic.
I can't touch my daughter, I can't touch my wife. I have to completely change my scrubs as soon as I enter in the hospital.
And if they catch COVID-19 while treating patients and can't work for a long enough period of time,
I'm getting deported from the country. That's where we are currently. That's the sad part. We are doing everything right, and we are staying shoulder to shoulder with my American colleagues.
I mean, you don't think about visa, or you don't think about green card in that situation. You have a skill set. You have people in the community, in your community where you live, who need help, and in that moment you forget about everything else.
An early-stage human trial for a corona vaccine is showing some promising results. Biotech company Moderna said today that all of the participants in its phase 1 trial produced antibodies. Some even produced higher levels of antibodies than people who have actually had the coronavirus. NBC News medical reporter Erica Edwards joins us now. And Erica, what else can you tell us about this human trial? People getting pretty excited about the news today.
Yeah, that's right. Well, this was a phase 1 clinical trial that has 2 main goals. Number one is to find out whether it's actually safe in humans, and the other one is to see whether it produced any antibodies. Now, this first phase had 45 participants that were broken up into groups of 3, so researchers could test the effect of taking different doses. Today, the company released data on the first 8, saying that those 8 people developed neutralizing antibodies at levels seen in patients who have already recovered from COVID-19. That's key, because it's believed that that is what is instrumental in providing protection from the virus. Now, another thing that's key here is that there weren't any bad side effects reported other than some minor redness around the area where they were given the shot. So this is all very promising. But remember, it is still very early in this process. We're talking 8 patients so far, so many, many more people will need to be studied to confirm the findings that were released today. Allison.
So, Erica, the drug now moves on to larger studies. What do those look like?
Yeah, so right now the company is pushing ahead with phase 2 of the clinical trial. That usually incorporates a larger number of people, and it's often the phase where researchers can really zero in on what dosage is most effective. The company expects to begin phase 3 clinical trial as early as this July. Now, phase 3 trials involve a much larger group of participants to confirm results of phases 1 and phases 2. And when you have a much larger group, researchers can also often find rare safety issues that will need to be addressed. Now, this is an extremely accelerated pace. Very often, vaccine research takes 10 or 20 years to prove that a vaccine is both safe and effective. The fastest a vaccine was developed in this country was 4 years. That was the Ebola vaccine just a few years ago. So this, of course, is much, much faster, which raises a few safety questions. Sometimes it takes much longer for potential problems to show themselves. Allison?
Erica, we know this isn't the only potential vaccine being tested right now, or any other showing this kind of promise, or just any kind of promise?
Yeah, so Moderna was the first to show this kind of promise in humans, but there are many other vaccine candidates all over the world in development. There's a group at Oxford University in the UK. Just last week, they released findings on studies that they did on 6 rhesus macaques. Now, those monkeys are considered to be good proxies for how drugs could work in people because they share a majority of their genes with humans. And all those animals did, in fact, develop antibodies. Oxford said it, too, is on an accelerated pace to develop a vaccine. There are 2 other U.S.-based companies, Pfizer and Inovio, also in the early stages of vaccine development. So stay tuned. Allison.
All right, Erica, thank you so much.
Thank you.
Dr. George Diaz, infectious disease section chief at Providence Regional Medical Center Everett in Washington State, is joining me now to dive into the promising results from Moderna's phase 1 vaccine trial. Dr. Diaz, how significant are these results? What do you make of them? Because people are getting pretty excited about the news.
Well, I think it's good news that we're seeing some promising results. It has been a small number of patients so far, but the fact that it appears to be effective at generating neutralizing antibodies, meaning that the antibodies that are made appear to be active against the virus, is very encouraging. And the timeline is rapid as well, which I think is also another plus, that they're going to be enrolling a larger number of patients over the next few weeks, and then hopefully a very large number of patients beginning this summer. So a timeline of January to June for vaccine release would be fantastic.
Let's be realistic, though. I know people tend to get excited, and then we start to think, oh, maybe a vaccine will come sooner than we think. Based on what we've heard today, when do you think it is reasonable to expect our first coronavirus vaccine?
Realistically, I think January is probably as fast as humanly possible to get a vaccine out. It certainly could be a little later in the spring, but I think January would be a great goal.
You actually treated the first patient to have a confirmed case of the coronavirus here in the U.S. We now have more than 1.5 million confirmed cases in the country. What have you learned about treating this disease since that very first case?
Yeah, we've enrolled quite a few patients into our clinical trial here locally, and we've seen the results that have come up. They've been at least discussed in press conferences and press releases about this drug in other studies. It appears to be active in reducing their time recovery. It appears to have benefit in terms of treating patients early who are able to get discharged earlier. Within our own health system, we've looked at our data and our experience, and we are also seeing mortality benefits. So I think the take-home message is that this likely will be part of the standard of care for treatment of COVID, and that early treatment is likely more effective than late treatment. We are waiting for all these studies to be published, including our own data set. So once we have those available, it will be really helpful to be able for doctors to look at this data critically.
Dr. Diaz, more states are reopening today. They're lifting social distancing guidelines that are meant to stop the spread of the coronavirus. What advice do you have for our viewers, especially viewers who are living in states that are starting to reopen? What should they be thinking about? What can they be doing to keep themselves safe as they start to go back to some more normal aspects of their lives?
So the reopening is occurring at the state level across the country, and each state's governor will be making decisions about the timing of this and what the phases look like. So I would, as a citizen, keep track of what my local governor is saying about the safety of reopening, but also especially to continue to maintain socially distancing practices when leaving the house, maintaining 6 feet between other people, ideally wearing a mask out in public if possible, washing your hands, and doing all the simple things to try to avoid possible infection. And if you are sick, to as much as possible stay home to try to avoid infecting others.
Great advice, Dr. Diaz. Thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.